Welcome back to the morning show here on Arise News.
When it comes to men and healthcare, the numbers don't lie. Compared with women, men are 24% less likely to visit their doctors in any given year, and 22% less likely to get routine checks done. They are also less willing to be screened for cancer, despite the fact that their cancer mortality rates are getting higher by the day. Joining us now to speak on men's preventive health measures, an important screening test needed to stay healthy and live long, is Dr. Nesochi OKEKE-IGBOKWE. Doctor, welcome to the show.
Thank you. Great to be
see
here.
you again.
Good morning, Doctor.
Morning.
Well, I have a quote here.
Yes.
This is from Demetrius Posh. He is the editor-in-chief of the American Journal of Men's Health.
Okay.
And he says, and I quote, "Men put their health last. Most men's thinking is if they can live up to their roles in society, then they are healthy." Is this true? Do you agree with him?
I do absolutely agree with that. So men in general tend to neglect their health, and they don't go to get any kind of help until things are far too late. Oftentimes when I see patients, especially male patients, they'll let me know that they actually take care of their cars better than they take care of their own health, that it's a push from a family member or somebody else to actually get them to get the care that they need. But the focus really needs to be on adopting this kind of a culture of prevention. If you can prevent disease, then you're ultimately lowering the costs of healthcare overall over the course of your life, and you're just preventing any negative harm that could occur to your overall health and well-being. So there are certain things that every man must do during certain points of their life in order to maintain and sustain and protect their health.
So what are some of those things? Because another phrase that's used with regards to men's health is that men are literally dying of embarrassment because when they see or notice certain symptoms, they don't want to, they're feeling too self-conscious to go and have it checked out. So what are some of these symptoms? What are some of these measures that, preventative?
So first I want to say, anyone who's going to see a doctor, you should never be embarrassed or scared of what any doctor is going to think. That's why doctors are there, to help heal, to help cure, to help treat disease. So if there's something that you think is so embarrassing, you should be open and honest with your healthcare provider just to let them know what exactly is going on. Oftentimes, if you hide some of these things that are going on, it's a recipe for disaster in the long run. But ultimately, in talking about the actual screening measures that need to be done, the first thing that every man needs to do when they do have their routine checkup is a blood pressure check, okay? So when we're screening for blood pressure, we want to ensure and make sure that no man has issues with high blood pressure or hypertension. So in checking for the blood pressure read, a normal blood pressure reading is less than 120/80. Anything greater than 130/80 means you have issues with high blood pressure. But if you're screening annually at your checkups, these things can be actually detected. So why is it so important to screen for high blood pressure or hypertension? Because when you are walking around chronically with these numbers that are very high, what that does is it increases your risk for stroke, it increases your risk for heart attack, it increases your risk for kidney disease. And a lot of these things can actually be prevented if you were just screened for blood pressure early on. And some of the lifestyle things that are done in your day-to-day life, that can contribute to the high blood pressure. So if it is screened out early enough, you can have that discussion with your doctor about whether or not you may be a candidate for medication, or if this is something we can change with what we call lifestyle modifications, meaning that you can talk to the doctor or nutritionist to pinpoint some of those bad foods that are contributing to the high blood pressure or hypertension, such as foods that are very high in salt. And also, exercise has to be a component of that too, to bring down that blood pressure, because oftentimes those that are overweight or obese, that actually is a risk factor for high blood pressure. So that's just one screening measure that every man needs to have done annually, and that really should start around the age of 18. Don't wait till you're feeling like you have symptoms or something is off to get that checked. Blood pressure is something very simple and inexpensive that really can be checked routinely just to make sure you are in the clear. So that's just one test.
Well, doctor, I understand that there's something called Men's Health Preventive Measures Week. Do we have the equivalent for women? Because as a man, you know, I look at it and I say, I mean, it's like we're being discriminated against.
Yeah, there's no discrimination there because there is a Women's Health Week, but the emphasis and focus usually when we do have the Men's Health Week, it's usually actually around Father's Day. So that's why they do Men's Health Week at that time, just to enlighten and bring that focus into certain things that men really need to take heed of. So women have their own special week for awareness and screening, but really awareness and screening is something that should be done year-round. We really don't need to have a special week for it, but this is just to raise more awareness during this time to let you know if you've kind of fallen off track. This is now time to kind of give you that reminder that it's time to remember some of these screening measures that need to be done. So there are a few more that I would like to discuss as well that we should actually keep our eye on as well. Such as the next thing that every man really needs to keep their eye on is their cholesterol. Cholesterol is usually highly overlooked by many people. So just a simple test that a doctor can do for you when you go for that evaluation, that routine checkup, is what we call a fasting lipid panel. That's just a cholesterol check to see where your levels are at. So when we talk about cholesterol, what exactly is that? So cholesterol is a waxy, fatty-like substance that the body makes, and we need a certain amount of it in the body to help with functioning of various things. But what occurs is that some people can have higher levels based on just neglecting some of the kinds of foods that they eat. So when we check this fasting lipid panel or this cholesterol panel, we're checking for certain things because there are various components of one's cholesterol. We have our total cholesterol, we have our LDL cholesterol, what is known as the bad cholesterol, quote unquote, the HDL cholesterol, that's the good cholesterol, and we have triglycerides, the fatty component of that cholesterol panel. So what's the ultimate goal? The goal is we want our total cholesterol levels to be lower. We want that LDL cholesterol, that bad cholesterol, to be low as well. We want the HDL cholesterol, the good cholesterol, to be on the higher side, because that's the good cholesterol we do like in the body. So why is it important to screen for cholesterol? What cholesterol does is when you have that buildup of the bad cholesterol, it can actually coat the vessels and the arteries in the body, and that actually decreases the flow of blood that can get to important organs like the heart. So it can manifest, the symptoms can manifest itself as having heart disease or issues with heart attack in the future when you do have that buildup of cholesterol. So we want to really make sure that your cholesterol levels are within a normal level to avoid what we call that buildup of cholesterol in the vessels, atherosclerosis. That's a huge risk factor for heart disease, for heart attack, and stroke as well. So again, if we do detect upon doing blood work that you do have this issue with high cholesterol, then it becomes, again, another conversation about lifestyle modifications, about pinpointing those foods that are contributing to the high cholesterol levels. Some of the things to look for, because I'm sure people are wondering, okay, what is really contributing to my high cholesterol? Things that you want to really be aware of are the red meats. When you're eating a lot of red meat, a lot of those processed foods, that contributes to the bad cholesterol. What are some foods that can counteract that or that can be some benefit to help with the cholesterol? We look at certain kind of fish, specifically fish that have something called omega-3 fatty acids. These are good fats, good fatty acids that help bring down some of those bad numbers in the cholesterol panel. But overall, it's really a multifactorial approach. You would talk to a nutritionist, you would talk to your doctor. If you do have this issue with high cholesterol, it's an ongoing thing to make sure that your health and problems with heart disease do not escalate and go to another point where it's more difficult to treat later on. And that's the whole point about prevention. You find and detect early, it's easier to treat if it does come up at some point.
But Dr. Sometimes medicine can be a bit confusing and frightening because some people say, don't eat this, don't do that, you know, and then the average man will say, if we don't eat all these things, you know, are we going to survive? But on the specific issue of cholesterol, I mean, I read a recent story saying that, you know, there's nothing wrong with cholesterol, that cholesterol is good. So but here you are saying that, you know, cholesterol is could be a risk factor.
Oh, absolutely. But we're talking about the specific kind of cholesterol that is a risk factor. And that cholesterol that I was speaking about is the LDL cholesterol. That's the bad cholesterol. We all need, a certain amount of cholesterol in the body to sustain certain physiological processes in the body. But when that bad cholesterol comes into play, that is when you're at risk. So we're not saying that all cholesterol is horrible, but specifically when we're looking at these levels and these metrics, you do not want those numbers to go above a certain level, because when they do, then that puts you at higher risk for some of those problems with heart disease. So essentially, I know it can be confusing for some to kind of determine, what they should be eating and what they should do to make sure their cholesterol levels are okay, but that just brings home the point that you should actually be having those annual checkups. You should actually be going to see your doctor so that you can have that conversation and that discussion, so they can let you know, A, where your cholesterol levels are, and if you need to do anything, any kind of intervention to remove certain foods in the diet that may be putting you more at risk.
Well, you've talked about lifestyle,
Yes.
heart disease, cholesterol, kidney, liver, and all that. But as a Nigerian man listening to you, I'd like to ask you, from your practice and study, in terms of seroprevalence, what do you think are the major issues that Nigerian men should worry about? Because, from conversation with other men, I know Nigerian men worry a lot about erectile dysfunction. They worry a lot about prostate cancer. They worry a lot about colon cancer, diabetes, you're right, hypertension, depression.
Of course.
Which is the...
So those are all things that I want to talk about, because that's part of the men's health screening. So far we talked about the issues with hypertension, high blood pressure. That's a risk factor or something to actually be very concerned about. We spoke about cholesterol, but another thing that we need to really discuss is diabetes as well. So that's something important that every man really needs to be screened for, okay? And what the doctor can do is actually do a blood test in which they check something called a hemoglobin A1C. This is about a 3-month measurement about how well your blood sugar levels are being regulated. When you go above a certain number, 6.4 is usually the number. When it's 6.4 or above 6.4, 6.5%, the hemoglobin A1C, that designates you as somebody having diabetes. So why is it so important to screen for that? You mentioned something about impotence. Diabetes that's uncontrolled can actually lead men to have...
Doctor, that will be of interest to a lot of Nigerian men who are watching. So we'll take a short break.
Sure.
And then we'll come back to you.
Surely.
We'll be right back.